So we'll talk today about the automated screening tool that's provided by Boston Scientific uh, for the SICD implantation. What do we have is that this topic is concerning more the EP people more than the cath lab people, to be honest, and the people who are dealing with the devices in the clinics. So subcutaneous ICD is just an extravascular ICD that is not typically inside the heart as the regular ICD, and it is providing a shock ability for the to prevent the sudden cardiac death. What do I need you to think about is to think about an external AUD. The device will work on ECG signals to see the signals, analyze it, then give the therapy upon the decision that it will make. So earlier, Boston Scientific people was doing the SICD screening manually. They have a ruler and they have let's say a nipple-shaped tool to measure the QT ratios. But nowadays there is no more human interactions in this process. It's all automated process. The device is doing it by itself. So why screening is necessary for the SICD? For the SICD, it is more of an anatomical device. So the position you are putting your lead on is affecting the signals you will read out of the device. So the purpose of the screening is to identify the small number of patients whose signals may be unusually challenging for detection and discrimination prior to implant of the SICD. So the process in the SICD implantation is to screen the patient. Then if the patient passes, then we'll go to the system implant, and upon the screening we'll choose the vector. So the surface ECG is representative of the subcutaneous signals. We call it a subcutaneous ECG. Therefore, a preoperative screening process was developed to analyze the patient ECG without the need to first implant the device, then to see the signals out of it. The screening process is used to analyze the QRS amplitude, QRS to wave amplitude ratios, and the QRS width, and the morphology consistency in the sinus rhythm using multiple patients' postures. So what we will do is that we will mimic the device function. We'll do it without implantation first. We'll see how the device will see the signals and how the decision would be made. Then we'll go for the implantation if it's suitable. What do we have in the SICD? What are the SICD components? We have mainly two components in the SICD. We have the lead, then we have the pulse generator or the device. So the lead contains two electrodes in the lead body itself and a shocking coil that is connected to a shocking box, let's say. We have three places to usually implant the lead in, which is the left sternal margin, the median, and the right sternal margin. Therefore, we'll come to a point that when we are screening the patient, people usually do it in a way that they are just screening the left sternal margin. So we need to screen the patient in the three positions to see the optimal signals. The patient might pass in the left sternal margin, but still has a better signals on the right sternal margin or in the median. So the process of screening needs to be for the whole three positions. So the screening tool I'll talk about is a simple screening tool that is provided by Boston in the 300 programmer. When you open your programmer, you will have the three icons. Let's say The first one is for the transvenous devices interrogation. The second one is the SICD application. You don't need anymore to have your small tablet with you to check the SICD device. So we have the application in the latitude 3300 now, and when you click that button, you will have the screening tool and the interrogation. We'll talk about the screening tool when we choose it, but the electrode positioning. What we will do is that we will connect the ECG, the service ECG, to the patient, and we need to mimic the electrode positions. So we'll have the lead of the right arm in the top, left arm in the bottom, and the left leg to the can. What is the top? What is the bottom? What is the can? When we are doing it, we have to palpate the xiphoid process out of the sternum. Then we have to go 1 centimeter superiorly to the left. Then we will put our left arm lead in there. Then for a 14 centimeters, we have to go above it. We have to place our right arm electrode there. Then the left arm just in the fifth intercostal space, and the right leg on the other side opposite to it. So we have in the SICD 3 vectors for sensing and detection. We have the primary vector, which is from the left arm to the pulse generator. We have the secondary vector, which is from the right arm to the left leg electrode. And we have the alternate vector, which is between the right arm and the left arm. Those are mainly the 3 vectors in the SICD. And this is how we will mimic the sensing process in the device. Nowadays, we have the instructions, those instructions implemented in the device. And whenever you forget it, you just, when you click the screening tool, you go to instructions, you will have it. Same process for every patient for screening. And also, Boston added, Boston added a 14 centimeters line in the screen where you can get a paper and you mark it, and then you go to the patient chest after palpating the xiphoid process and put your other lead above it with the 14 centimeters exactly. So, best practice is to do screening for the 3 places: right sternal margin, median, and left sternal margin. What is different here nowadays is that when the patient fails the screening, you will know why the patient failed. You will not just see as signals that you don't know why the patient failed. That's it. The reasons usually for failure for SICD screening comes in 5 points. The first point is R wave is too small. When the R wave is too small, below 0.5, the device will not sense it properly. So the device will not allow you to implement, the screening tool will not allow you to implement the SICD. Number 2 is that the score is too low due to large R wave. So when we have a small R wave, this is an issue. And when we have a too large R wave, this is also an issue. An issue because the R wave would be clipped and a double detection might happen with this. So the screening tool will not advise you to go to implant SICD. The third one is the score too low due to low RT ratio. So in the earlier days, people had an issues with the ratio between the R wave and the T wave. The device was double detecting it. And there is some situations until now it happens, but the Boston Scientific developed some algorithms and some filters to prevent this from happening. So a ratio of the average R wave amplitude to average post R wave amplitude was too low. Is more less or equals than 3. The fourth one is the score too low. Score too low means a combination of two or more of the previous ones. So either we will have R wave too small and score of RT is too small, or we will have the score too low due to large R wave and the score too low due to RT ratio. The fifth one is too few good beats. Too few good beats may have a lot of meanings, but when we don't have a consistency of the amplitude and the sensing out of the device would say, I will not allow you to implement an SICD because simply I'm not sure if I will see it in the future. Nowadays we'll have Heart Connect. What is Heart Connect? Heart Connect is a tool that allows you to have Boston Scientific customer support with you all the time. Simply connect the programmer to your hotspot, your mobile hotspot, then go to the Heart Connect button, just click Meet Now. You will have Boston Scientific technical support with you all the time. So what is the benefit out of this is that when you are doing an SICD screening, you can do it under supervision of one of technical support. While you are alone in the hospital, when you have a transvenous device with a troubleshooting you need out of the device, just go to Heart Connect. You will find someone there to talk to and solve the issue. Heart Connect, to be honest, is now available in Saudi Arabia. We have it in all the programmers around the kingdom are updated to the latest version, which allow the usage of Heart Connect. Just use it. We are happy to. Yeah, I mean, have you satisfied with it? Thank you. This was my presentation. Thank you.